We have to realize that we have to have a breakthrough innovation in testing. We have to be able to detect antigen rather than constantly trying to detect the actual live virus or the viral particles itself, and to really move into antigen testing. And I know corporations and diagnostics are working on that now. We have to have a breakthrough. This RNA testing will carry us certainly through the spring and summer, but we need to have a huge technology breakthrough.
Dr. Deborah Birx, the White House Coronavirus Task Force coordinator, on the breakthrough still needed when it comes to coronavirus testing.
Well, it's very interesting that, again, on March the 6th, Donald Trump said anybody who wants testing can get testing.
Yeah.
All this time later,
bold-faced lie.
She's still telling the truth, Dr. Birx, just like Dr. Fauci, talking about we need more testing. And that's, by the way, that's not the be-all, end-all. That's just the start of the process.
And Dr. Anthony Fauci said in an interview with Politico on Saturday that the U.S. should at least double coronavirus testing in the coming weeks before reopening the economy. The New York Times reports that some physical components of test kits, like nasal swabs, are largely imported and hard to come by. Healthcare workers are still lacking the necessary protective gear to administer tests on a wide-scale basis, and labs have been slow to add people and equipment to process the growing number of tests. Governors, public health officials, and hospital executives tell the Times they are still operating in a kind of Wild West economy that has left them scrambling and competing with one another to procure the equipment and other materials they need. And so states are left with that kind of uncertainty as they try and figure out how and when to reopen their economies. One group is offering a way forward. The National Center for Disaster Preparedness at Columbia University's Earth Institute. It's out this morning with a phased plan to safely reopen local American businesses while still protecting the health and safety of workers and customers. Joining us now, author of the report and director of Columbia University's National Center for Disaster Preparedness, Dr. Erwin Redlener.
So, Doctor, thank you so much for being with us. Tell us, what does the plan look like?
Sure.
Sketch it out for us.
So here's the main point. So I listed 9 different kinds of businesses and industries that could open, but every single one of them, Joe, is dependent upon us having the ability to test rapidly and to test broadly. So Dr. Fauci is 100% correct, and so is Dr. Birx in this case, because and there's a plan there for, let's say we want to open, your local barbershop or restaurant. We need to make sure that everybody that works there is actually negative for the coronavirus. If we don't do that, all of the plans to reopen businesses have a serious, dangerous flaw. And we watched with some astonishment that the governor of Georgia decided just to open, basically, go for it. And I think that presents a real and present danger to the health of the public in Georgia. And I just want to caution governors that they really need to make sure that, first of all, everybody understands we need to open up business. This is absolutely critical. But we have now a kind of a pitched battle between public health experts and the people that want to focus on reopening the economy. But there is a middle way, and that middle way is dependent upon testing, number one, and also the ability to do contact tracing. If somebody gets positive, we need to be able to figure out who they've been in touch with and screen those people as well, Joe.
So, Doctor, are you moving closer to a point where you have confidence in the results of the testing? We heard even a couple of weeks ago the FDA itself concerned by the inconsistency of some of these results. Some of the tests,
Sure.
in their words, in effect, junk. Do you think we're moving beyond that phase?
Well, first of all, I used to be optimistic about where we're going with testing, but we've had now more than 2 months of constant misrepresentations of the truth, messages that make no sense whatsoever from the White House about what went wrong. We're now in the catch-up phase, and it's really, really difficult, Joe, because many of the tests that have been developed and have gotten emergency approval, let's say, actually have lots of false negatives and false positives. I think we're far from the technological solution to the testing dilemma, which is amazing that the United States of America is having so much trouble with a basic technology that is so critical to the public's health. This is incomprehensible. someday there's going to be some kind of hot wash or post-mortem on what we went through, but we're certainly not ready for widespread, accurate testing that can be done very quickly. It's a shame. It's inexplicable. Yeah.
And like you said, it's inexplicable. It's incomprehensible that in a country that is as scientifically advanced and medically advanced as we are, that this president and the White House still continues to stumble over the basics of testing. Hey, Doctor, the AP's Jonathan Lemire is with us and has a question for you. Jonathan.
Sure. Hi, Jonathan.
Hey, Doctor. Just in the last few days, Michael Bloomberg, in sort of his first step back onto the public stage after his failed presidential campaign, it was announced by Governor Cuomo that Bloomberg will be funding a contact tracing effort in the New York City area and region, expanding slightly into the neighboring states. Can you walk us through? It was described, the governor said, as a very expensive and complicated procedure. Can you describe exactly what it is, why it's so important, and is it still so necessary in areas like New York that have had such community spread?
Sure, Jonathan. So first of all, it's basically inevitable that we're going to get at least a second wave, not a third wave over this next 12 months. And the reason is there's going to be people out there that are still carrying the virus. And what we need to be able to do, this thing called contact tracing, is if you test positive, people need to know who you've been in contact with that also might be positive, because that could be the beginning of another upsurge. The problem is we have about 2,200 to 2,500 contact tracers in the United States, and some estimates, including a study from the Rockefeller Center, say that we'll need between 200 and 300,000 people to do this contact tracing. So we're way behind. It's great that Mike Bloomberg is doing what he's doing, but we're going to need a lot of focus on that. So, but if we get the testing right, big if, and we can figure out how to do effective contact tracing, maybe we don't need 200,000, maybe 100,000, but we need a lot more. They have to be trained. That can happen quickly. But once we get testing and contact tracing, we'll be making progress. Bloomberg has got his finger on the pulse of what needs to happen, and that's great. But the scale is enormous. And this is the other thing that we're getting from the White House, a complete ignorant misunderstanding of what it is that we'll need to get this under control, Jonathan.
Dr. Irwin Redlener, thank you very much for coming on this morning. It's great to hear from you. Up next, we just heard an outline for reopening. How does that apply to one of the country's hardest hit states? We'll ask Governor Phil Murphy of New Jersey next. And as we
Thanks for checking out MSNBC on YouTube, and make sure you subscribe to stay up to date on the day's biggest stories. And you can click on any of the videos around us to watch more from Morning Joe and MSNBC. Thanks so much for watching.